If someone's coming to you with chronic neck pain or they're in pain and you keep adjusting them and their symptoms aren't going down, and the reason we're talking about signs and symptoms is that if the alarm's still on, if the brain is still registering that there's a problem, the person's not healing, they're probably not sleeping. And so clearing the subluxation restores a normal brain to body communication. So that should be the ultimate goal with the adjustment, is to enhance what innate intelligence has already been, trying to do. And so we clear the subluxation, we clear the misalignment. Now, if signs and symptoms persist and they say, yeah, the problem's still not going away, you're checking in on it. Just like you might check the pubic symphysis for a chronic situation, you want to check the anterior cervicals. And so what I like to do is we'll check rotation, lateral flexion, whatever that feels like, whatever vector you're thinking. And then I'll come over the other side and I'll see if this has dipped forward, or it feels like it's dipping forward on the opposite side, the segment. And I'll do it two-part, especially if the individual is having a hard time with diversified adjustments and intense ones. You might break it down into 2 steps. You clear the rotation, lateral flexion on one side, and then you come over the other side and you use a gun contact, and you come downhill on that uncinate, which is sitting right through here. You're coming downhill, which has a small synovial joint that sits right in through there. It's movable. That's why feels like it's getting jammed on that front side. And you're just coming down the hill on the opposite side. Those of you that are strong and can really bring it, you can clear this out as a bilateral. MLS would call it a bilateral. You stabilize the other side and you're bringing it right through. For those that don't get adjusted all the time, can't take a lot of force, this might be what some might call a humdinger. And so for those that are lighter force, break it down into 2 steps. Clear the rotation component or whatever it is on the one side, the body right, body left. And then go to the other side, take your gun contact, nice, smooth, strong, safe contact, and come downhill in the line of feel, in the vector line of drive there.